Hello and welcome. My name is Katherine Salesky. I am a Master's in Public Health student at Liberty University. Today I will be discussing my Health 698 practicum with the Maryland Rural Health Association entitled Increasing Rural Maryland Health Outcomes. Next slide, please. Before I begin, I wanted to share with you why rural health is important to me. Living in a rural community, I can truly relate with this photo. My husband has had to wait for over 6 months for an appointment with a specialist, and I have had to travel over an hour for medical treatment. Approximately 46.2 million residents are like me and live in rural America. For those living in rural jurisdictions, they face significant health challenges, including some of the highest rates of risky behaviors and the worst health outcomes of any group in our country. The obstacles faced by healthcare providers and patients in rural areas are vastly different than those who live in urban jurisdictions. Economic factors, cultural and social differences, educational shortcomings, lack of recognition by legislators, and sheer isolation of living in remote areas all conspire to create healthcare disparities and impede rural Americans in their struggle to lead normal, healthy lives. Although there is no single definition, rural jurisdictions often share common characteristics such as geographic location, transportation barriers, and limited access to and availability of health care. Because of my special connection to rural health, I wanted to assist my community in increasing their health outcomes. Next slide, please. My practicum was done with the Maryland Rural Health Association, so I will give you a little bit of background on the Maryland Rural Health Association. The Maryland Rural Health Association is a nonprofit organization whose mission is to educate and advocate for optimal health of rural communities and their residents. The Maryland Rural Health Association is the primary advocate for quality rural health in Maryland. The MRHA recognizes an organization is only as strong as its members and values the support and involvement of its members, for they are critical to the future success of the organization. The members of the Maryland Rural Health Association are comprised of health departments, hospitals, community health centers, health professionals, and community members in rural Maryland. Of Maryland's 24 counties, 18 are considered rural by the state, with a population of over 1.3 million, and differ very greatly of other urban areas in Maryland. The purpose of my practicum consisted of strengthening the healthcare, and well-being of rural Marylanders through leadership, advocacy, education, and collaboration. Next slide, please. So, in order to accomplish this, my practicum consisted of 3 objectives. The first objective was, by October 2017, increase awareness and build capacity of rural health access barriers in 150 individuals through educating and advocating for public health access initiative specifically designed for rural Marylanders at the 2016 Rural Conference held at Solomons through conference evaluation. The second objective of my practicum was by November 2016, mobilize community stakeholders in 6 Maryland counties to identify and solve health problems related to rural Maryland through community health workers. And the final and third practicum objective was by December 2016, create and publish white papers for legislators on lack of rural access to primary and dental health care in rural Maryland, vulnerable populations and social determinants of health, and rural behavioral health to be used for education and community-based programs to establish legislative solutions in addressing these health problems in rural Maryland. Next slide, please. In this slide, I provide you information regarding the 2016 MRHA Rural Conference. The 2016 conference was based on the Robert Wood Johnson Culture of Health Framework and held in Solomons, Maryland. The Robert Wood Johnson Foundation has proposed a vision for a national culture of health, enabling that all diverse society are able to lead healthier lifestyles. The 2016 conference featured critical health issues facing rural Maryland, It provided information on practical public health strategies that use data-driven and evidence-based practice to improve population health and health outcomes at a local level, and it also set the stage for the 2017 Rural Maryland legislative agenda. So, in addition to completing the programmatic and logistical aspects needed for a successful conference, I was able to propose the question as seen on this slide on social media. As you will see, some of the responses are quite informative regarding participants' feelings toward rural health importance. As you will see, some participants noted, illness and disease do not care where you live, and no one should be left behind. I truly feel that I have increased the awareness of those individuals, the importance of rural health in rural Maryland. Next slide, please. As you will see in this slide, part of my practicum consisted of a community health worker training evaluation. Community health workers are an excellent medium for improving outcomes in underserved rural population that are experiencing chronic disease health condition. In a clinical context, community health workers can be utilized for health promotion and disease prevention, injury prevention, maternal and child health care, cancer screening, and chronic disease management. Utilizing the 160-hour Maryland Area Health Education Center curriculum, 15 students completed the 5-week program. With guidance from the Maryland Department of Health and Mental Hygiene and the Maryland Insurance Administration, the curriculum is based on these 11 core competencies needed to be a community health worker in Maryland. In evaluating the curriculum, the students were asked the following questions. They were also asked an additional set of questions. However, I only wanted to present to you questions regarding the actual curriculum. As you will see, most of the responses are positive when asked gaining worthwhile knowledge or creating those connections, and many of the students had an overall positive outcome of their community health worker training. Next slide, please. The final objective of my practicum was in regards to creating white papers that would be used for the 2017 Maryland legislative session. Originally, the term white paper was used as a shorthand to refer to an official government report, indicating that the document is authoritative and informative in nature. Writers typically use this genre when they are arguing a specific position or purpose, or propose a solution for the problem, addressing the audience outside of their organization. So, during my time at the Maryland Rural Health Association conference, I had the opportunity to facilitate breakout sessions regarding each of these 4 different topics, regarding vulnerable population or social determinants of health, access to primary care, access to oral health, and mental health, as these issues are very common in rural jurisdictions. With the information that I received from the breakout session, I was then tasked with finding additional sources to be used in the creation of white papers and assist in the construction of these white papers, with the first white paper, Vulnerable Population and Social Determinants, to be submitted by December 1st and will be utilized again in the 2017 Maryland legislative session. Next slide, please. As I come to a conclusion, I want to remind the audience that the healthcare system has changed drastically over the past decades, and rural health outcomes are lacking. With an increase in awareness of the issues rural communities are facing, and through the utilization of community health workers, rural communities may see an increase in health outcomes. However, continued work is needed with awareness and advocacy to maintain the momentum of these rural voices. In addition, rural communities must continue to engage policymakers. And I want to note that it's important to engage those partnerships in getting the knowledge across in regards to this policy. And finally, I will close with the words of Hebrew 13:16, and don't forget to do good and to share with those in need. These are sacrifices that please God. I find throughout these past 16 weeks, I hope that I have done good and that my sacrifices will then lead and continue throughout my time in rural Maryland. thank you. As seen from my next slide, there are my references for this presentation. And finally, in closing, you will find my thank you slide, and I wish you the best, and I thank you guys very much for this time.